show you the back of it too. So for this one, we can actually see where everything comes. So this is our central line that comes from our pressure reducing valve, right? Comes down through here and goes into the back of our flow meter. This tube here is what attaches to our oxygen flush. That's why we never press that oxygen flush button when when our breathing circuit's still attached to our patient, right? Because now we're flushing through huge pressure of air in through their lungs to fill our bag. Okay? So from here, it comes in through our flow meter, which is here. So flow meter comes out through the back, and you'll actually go through the vaporizer, okay? And you can see the vaporizer feeds down through here. Okay? Down here is where a couple things happen. So for this one, this little switch here controls whether we are using our non-rebreathing or our rebreathing side of the machine. So absorber stands for rebreathing, right? Because we have an absorber canister. And Baines, we know a Baines is a non-rebreathing circuit. So if I set it to the Baines, I'm going to set it up for my non-rebreathing side. If I follow my tubes around, I can see that this is my fresh gas tube. It's the same tube as what our sort of milky colored tubes are attached over there. So this will attach directly to my Baines circuit itself. So if I follow the breathing process, I know fresh gases are coming out of here, and I know my fresh gases need to go through the inner tube. If you have a look inside, you can actually see that this little nub in here is what feeds into my green tube. So I know that those two things need to attach together. Now my patient breathes in through the green inner tube, they exhale through the clear corrugated tube, and it's got to go out to the garbage in the bag. That's always closest to the pressure manometer here. So it comes out there, and my bag is underneath that. Okay, these things are always really close to each other. From here, the patient breathes out. It goes either into the bag or out the scavenge, and my scavenge hookup is here. Okay, questions about the non-rebreathing side? Where's my pop-off for it?
Is it the one in the back corner?
Yes, it's this. So my pop-off for this side is in the back here. And you always want to make sure that's set half full. Okay, so now if I'm going to be doing my absorber system or my rebreathing system, I need to switch it, okay, so that it's now directing my air up here. So I can figure out, I don't have a tube, but I can figure out the side that the air, fresh gas, comes out of by knowing where the garbage air goes in. And if we remember that the garbage air always goes out where our pop-off and our bag and our scavenge hookup is, I know this is my fresh gas inlet. So from here, I'm going to take my F circuit, and the inside of my F circuit here I can see feeds into my colored or my blue or green tube. That's the one that our fresh gases pass through that our patient breathes in. So I know that needs to attach here and match that one. Patient breathes in, they exhale through the clear corrugated tube, and I know the garbage tube needs to be close to my garbage pieces, which is my scavenge and my pop-off. Okay, bag hooks up here. So when my patient exhales, the air gets pushed through the soda lime canister and is either recirculated in through my inspiration flutter valve here, or a portion of it goes into the bag, or a portion of it goes out the scavenge, which is hooked up on the other end of my scavenge tube.